Adolescent medicine is a subspecialty that deals with 10 to 25-year-olds in particular, and the problems that they encounter that may be different from the problems that are seen in general pediatrics. We deal with a lot of issues in the adolescent medicine clinic. We deal with anxiety and depression, which often become apparent during the adolescent years. We deal with chronic pain, chronic fatigue. We work with patients who have disordered eating patterns, who develop malnutrition, who develop binge eating disorder. We work with patients who have sexuality issues, sexual orientation concerns, are grappling with gender identity. We work with all of the issues that require adolescent subspecialty care, but also oftentimes these problems become overwhelming for a general pediatric practice. Adolescents don't come to medical providers that often, and the ability for a generalist to have a lot of experience dealing with those issues, and specifically the really tough illnesses with which they may arrive, it's difficult. Adolescent medicine subspecialists are specifically trained to deal with this age group in a developmentally appropriate way, in a way that also involves the integration of the entire family in the treatment. So a lot of the problems that affect adolescents are a unique combination of sort of psychosocial issues that then affect physical health. So it's really important in adolescent medicine to have a team that can address all aspects of health, including mental health, nutrition, and of course, physical health and medical care. The Adolescent Medicine Clinic here is really a place where kids can access all their healthcare needs, mental health, medical care, nutritional support, under one roof, hopefully in one afternoon. And it's important for the adolescent to start to develop a sense of autonomy in dealing with the medical world. We very much value the input of the family and the parents in particular. That's never eliminated. It's just the focus shifts a bit. Anytime we talk to adolescents, we want to make sure they have the ability to interact with us, even in a confidential way, where there may be issues that they don't want to necessarily discuss directly with the parent in the room. But we always encourage the patient to discuss anything that we talk about privately with the parent and with the family. We never promote secrets. We only want to provide safety. So the parent really is the adolescent's biggest ally and strongest supporter. So we would never want to eliminate the parent from the scene. Our programs are all sort of nestled under the Adolescent Medicine Program, Medicine Clinic. And we do that specifically because if we were to name these programs as clinics, then we would be outing our adolescents simply by virtue of what clinic they're attending. So we want all of our teens to feel comfortable and safe, as though they have a private space, coming to the Adolescent Medicine Clinic for whatever problem or program with which they wish to engage. The interdisciplinary team approach is clearly needed, which is not available in a lot of general pediatric practices. And we have the time to be able to devote to these problems. They are time consuming and they do require the development of a fairly special relationship with the patient and the family. The gold standard, the optimal care for adolescents, includes an interdisciplinary team. The medical providers are often fairly well reimbursed by insurances, but the mental health providers usually aren't. So we only get reimbursed really pennies on the dollar, maybe 30 to 40 cents per dollar charged for the mental health provider, who is in many cases one of the key providers in an adolescent health concern. And the dietitian is reimbursed even lower than that. So these team members that really are critical to truly optimal adolescent care are rarely reimbursed, which is why you don't see a lot of adolescent health practices outside of academic centers. We really rely on the support of those who understand the importance of this work.